The relationship between stress and cardiovascular diseases. Introduction. Cardiovascular diseases are presently the leading cause of death in industrialized countries and are expected to become so in developing countries by 2020. Many experts have suggested that maintaining and even improving the stress for those patients, especially the elderly, might be one of the major goals of treatment. Aims of the research. The purpose of this paper is to determine the correlation between the level of stress and cardiovascular diseases. Materials and methods. Participants. There were 40 patients, 20 male and 20 female, aged from 35 to 50 years. Patients are diagnosed with angina pectoris 20 and myocardial infarction 20. Instrument of research. Perceived stress scale of Cohen. Results. Most of the patients with cardiovascular disease had moderate and high level of stress. PPI score ranged from 0 to 40. After scores of the entire sample were subdivided into 3 categories. 5% of patients had low stress, 70% had moderate stress, and 78% had high level of stress. The relationship between stress and the type of heart diseases. The prevalence of stress between the patients with angina pectoris and myocardial infarction is given on figure. We can see the patients with angina pectoris has high level of stress than patients with myocardial infarction. The relationship between stress and the type of heart diseases. As shown in the table, PPS mean scores in patients with angina pectoris was 27.2 points, with values ranging between 0 and 10 points. The mean average of PPS among patients with myocardial infarction was 19.9. Correlation between the level of stress and gender of patients. It is very interesting that the level of stress in patients with heart disease depends on the gender. The relationship between stress and the type of heart diseases. As shown in the table, the mean PPS scores of female was 24 points, while for male was 22 points. From figure, we can see that the correlation of statistical signification between the level of stress and gender is at the level of P lower than O. Correlation between job status and level of stress. One of the most interesting findings in our research was that employed patients with heart disease had higher level of the stress than unemployed patients. Job status together with stress appear to be important predictors for ischemia during daily life among cardiac patients. The mean average of PPS among employed patients was 25.3 points, while in the unemployed patients was 9.5 points. There was a significant positive correlation between job status of patients and stress is at level of P lower than O. Discussion and conclusion. Stress has a major impact upon the circulatory system. Moreover, we find strong evidence of an importance of stress in disease processes related to the circulatory system. Stress plays a significant role in susceptibility progress and outcome of cardiovascular diseases. Based on the results, we saw the stress is greatly present in our patients with heart coronary disease recovering at the clinic hospital in Tetovo. A higher scale of stress was present in female patients compared to male. Employees who experience work-related stress and individuals who aren't socially isolated or lonely have an increased risk of a first coronary heart disease event. Work sometimes can be an overloaded factor for the person who had coronary heart disease. The workers that feel fatigue in a long and hard work are most stressfully. There was also a difference in the stress scale of patients with angina pectoris and those with myocardial infarct. Patients with angina pectoris experience higher scale of stress than the patients with myocardial infarcts because the patients with angina pectoris feel pain which is more frequent and last from 5 to 15 minutes and more depending on the type of angina pectoris. During the chest pain phase, which is typical to patients with angina, they face worries and feel that something bad may happen. We think that to decrease stress it is necessary increase the active presence of psychologists and other professionals in undertaking appropriate measures to treat stress. Thank you.